You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new technology that literally freezes fat off the body in unwanted areas where you can't get rid of fat. With us, we have a board-certified dermatologist, Dr. Stewart. Dr. Stewart, welcome to the program.
Thank you for having me, Randy.
So is that true? I mean, it actually freezes the fat cells die, then the body just gets rid of the fat.
Eliminates it, exactly. And it freezes the fat without harming the skin or the inner organs or anything. The arteries, the nerves are all fine, but the fat goes away in 6 to 8 weeks. It may take a few months longer for some patients.
And it works?
And it works. Definitely works.
Okay, good. So I have a lot of questions for you. And for anybody watching this, these photos are pretty good. They're really good, as a matter of fact.
I think they're
I want to
great.
make sure they stick around for that. But for people that don't know your practice, because you do a lot of things, who's your typical patient and what are the different procedures that you do?
Well, I don't know if I have a typical patient because I have patients of all different ages. I see young patients, teenagers, and patients in their 80s, 90s, even in hundreds. I have a couple of patients that are made it up that far.
Is that right? Okay.
They really have. And I see them for all different things. I see them for skin cancer, for body checks, acne, warts, but then I also see them for a lot of cosmetic procedures. A lot of patients will come in, for example, for a skin check, which is very important. But then they go, what can you do to help me look better? I look tired. How can you make me look better? So we go through different...
And you're big on technology in your practice.
We have a lot of technology.
I mean, you have like...
And I try to stay up to date with the newest procedures and treatments and everything that's safe but new.
So, we talked on the phone, and you said, I'm paraphrasing, but you could take somebody in their late 30s, and if they start with you, you could keep them looking around that age for the next 10, 20 years maybe.
Well, we try to do that for sure.
Is that right?
We can really, prevent them from making their wrinkles deeper with Botox. We can plump up their skin with fillers. We can make their bodies better with the Zeltique, the CoolSculpting, and keep them young. And I'm in Colorado where people are fit and they want to stay looking as young as they feel because they're active out. They do a lot of outdoors. They like to hike and ski, and so we want to keep them as young as they're feeling.
What's the most popular procedure for skin that you do?
Well, probably one of the most common are Botox and filler, but we certainly also have IPL, Intense Pulse Light, which is a great treatment that actually helps brown and red. So someone that comes in with brown spots and blood vessels, sun damage, photo damage, that's a very common procedure, and it's very little downtime with it.
What about somebody with like olive skin or darker skin? Are you able to?
Yes, definitely. We certainly start with creams and get them the base, starting with different things to help improve their skin, and sunblock for sure. And then we can proceed with other treatments such as the thulium part of the Fraxel laser is perfect and very safe for a darker skin patient. So we can pick up the brown, which is harder to do with a darker skin patient or olive skin because a lot of lasers go after the color. So we have to differentiate between their pigment they don't want and their normal color. The thulium allows us to do that. We also have some peels that we can do as well. We individualize each patient, we look at them, we see what's best for them, go over the downtime, the price. We have a lot of different things we could offer in our
Do you do
office.
most of the procedures there in your practice? You have RNs that you work with?
I have
estheticians?
2 estheticians that are laser techs that actually do a lot of the intense pulse light. Some of the other ladies, we have a new laser called Sublated, which is for acne scars. They do that. I do some of the deeper lasers.
Acne scars, you could take care of those?
We
now?
actually can improve acne scars, yes. And that's a very common problem with a lot of patients,
okay.
a lot of people.
Now, sun damage,
Yes.
people with kind of leathery skin.
Almost
70s,
everybody
80s,
in Colorado
right?
has sun
because,
damage.
It's 70s, very
Yeah.
healthy today, very young today.
Yes.
Is it too late for them?
I don't think it's ever too late. I think you can always start and try to reverse some of the damage that's been done. So we have a lot of different treatments. We have in the Intense Pulse Light, as I mentioned. We have the blue light, which we can add onto the Intense Pulse Light. We have the thulium, the
What's the blue light do?
The blue light, actually, it's another light device that we use in conjunction with an acid called Levulin. Photodynamic therapy is the other name for that. And we can do that in combination with the IPL to even get more bang for your buck. So instead of coming in for 6 IPL treatments, if we add the blue light with the Levulin to the IPL, we may be able to do it in 3.
Okay, good. Okay, CoolSculpting. Moving on to CoolSculpting. That's the hot topic.
CoolSculpting's cool.
And I told you.
It's a cool topic.
It's a cool. Now we're very skeptical about this because people ask me too. I told a few people that you're coming on the show, and everybody wants to know: does it work? Is it real? Even the makeup artist today, she's telling me, she goes, "Does it work?"
Right. She just had a baby 9 months ago.
Do patients say the same thing?
Yes, she's an ideal candidate because she has this extra skin that she doesn't want anymore. She says, I want to get back to my body weight like I was before the baby. And we actually have patients like that all the time that have a little fat they can pinch still. Most common area, the flank, the abdomen. We can get rid of that. If you can pinch an inch or two.
So the part you could pinch, help me understand the process. Okay, so let's begin with the abdomen. Okay, so those love handles.
Yes.
How does it work to get rid of the fat? That's the part I don't get.
So we have different apparatuses that are used for different areas. So we have an apparatus, and we actually have 2 machines. We call it dual sculpting because we can do a patient's flanks, the love handles, both at each time, 1 and 1. And so we're able to do that, and the applicator goes onto the fat. It molds to the fat and skin. It stays on there for like an hour. The patient could be like sitting there, you know, doing looking at their iPad, reading a book, eating. We advise them to eat, actually. We like them to, and if they don't have their own food, we'll supply it for them. And they sit there, they're having a fun time, they're hooked up to the machine. It's very relaxing, actually. They like...
So it grabs the fat.
It grabs the fat, it vacuums it up into the applicator.
So that's suction.
But there's nothing that's invasive. So there's nothing coming out of your skin, or it's just grabbing the fat, and then the skin and the fat mold to the applicator. When we take the applicator off, it looks like a molded area of red butter. The freezing makes it cold.
So you're freezing, so that's very cold.
That's very cold. It freezes the fat, but not the skin or the nerves or anything else that we don't want to freeze. So it's fortunate that we freeze fat at a different temperature than the skin and the nerves and arteries and veins. So when we take the applicator off, we then have to manually massage out the rounded mound of fat that we just froze. And the massage they've shown is very important. And so now we're massaging it out. The patient may be a little puffy for a day, a little sensitive for a few days perhaps.
But that fat is what, killed at the cellular level?
Yes, it's over time, over 6 to 8 weeks really, that the fat cells die. It's called apoptosis is the medical word, but anyway, the cells die and then they go out through your lymphatics eventually. And it's just a slow kind of process. You don't notice it right away. It's like you'll be looking, I don't see much, and all of a sudden it's like, wow, my jeans fit again.
Well, everybody has a little bit of fat they want to get rid of.
Just about.
What about you? Have you used it?
I've actually had it done.
Right?
You know, and I'm a tall, pretty thin person, but it's like I had this fat, and I actually had a plastic surgeon friend that I asked, can you lipo this out? And they said, no, it's your back fat. We can't do that. It's too. But I had it done with the CoolSculpt, hooked up. And you know, and I actually, because I'm tall, I had to do 2 areas because I had a little bit longer of an area than just the one area. So I did it twice on each side, and I definitely see a difference. So I actually bought a dress whenever it was, and I had to get the dress taken in. I mean, so there's a downside to it that I had a new dress that I had to get taken in. But anyway.
And your husband?
So the reason why I got the machine, my husband's kind of like my guinea pig. And he's 10 years old.
He talked you into it?
He's 10 years older than I am. And so he wants to stay fit. He looks good. He does P90X. He's always working out. He cannot lose these love handles. And he tried several other machines before he came and tried the CoolSculpt.
Okay.
So he tried the CoolSculpt out. And it worked for him. So once it worked on him, he's like, okay, we're getting the machine. And we decided.
I saw his photos. Very impressive,
and I have them. I'll show you later. Yeah.
Okay. Okay.
He had love handles, and now I have to pinch something else because there's nothing to pinch there anymore. So he actually looks great. He's very fit, and he likes being fit, but that was the one trouble spot that he just could not work it out. It just nothing. The P90X didn't work. I don't know, Tony, he's out here.
Tony Horton.
Tony Horton. Yeah. He's the P90X guy. You know, so Dan did all those moves. He still does them.
So when diet and exercise doesn't work,
yes,
that last little part of fat, it's very difficult to get.
And this is an area that flank area. That love handle area is very common for men and women. And Colorado is a very fit society. So these are, a lot of our patients that are coming in are these women that are workouts, they work out all the time, and the men that work out, and they just cannot get, I've had a couple of actually trainers that have come in and had it done because they can't even train it off by working out all day long. So it's just a nice, easy treatment that's effective, very little downtime, if any, other than the hour that you're in the office or 2 hours that you're there. So it's a very nice treatment.
So for that, you call it a muffin top, great for women in that area?
Yes. It's perfect for that area. That is the most common area, I think, when women come and go, this is overhanging, you know, or they wear their Spanx, and the Spanx doesn't quite fit right because there's an overhang over the Spanx. So this really, we can mold it, apply it to them and really get them to look better in their clothes, look better out of their clothes sometimes as well, which is, because we have a few pictures I'll show you where this woman looks great, but she wants to look even better in her bikini. So we have people that want to look better in their clothes, people that want to look better in their bathing suits or their workout clothes.
What have some of the patients said after it's done? The results?
They've been just so thrilled with it. I mean, we had, and sometimes they don't see it right away until we show them their after pictures, you know. Sometimes they go, oh, look at that, you know, because you see yourself. This is true of a lot of cosmetic things that we do. That's why we take before pictures, because people see themselves every day, they don't notice the difference necessarily until they see the pictures or they see their clothes. And we actually ask them to bring their same jeans in to take before and after pictures, because that's where you see it. Sometimes these tighter jeans, that tight, and then the overhang above it. So we try to bring that overhang of fat down.
Is it more women than men that are doing it so far?
I would say we do both. We actually have a big men clientele, but a lot of women as well. One of my favorite stories is a lady that came in. She actually came in because of her back fat. It's the fat that bulges out over our bra.
You could do that area.
So we can do that area. And we actually also mentioned she should also do her flanks. So we did those two areas.
Flanks are the love handles.
The love handles, okay, right back here. So the back fat, which is the bulge of the bra fat, and she was going to her daughter's wedding. And the ex-husband with the younger girlfriend or younger wife was going to be there. So, and she didn't know what dress she was going to wear yet. But the husband, the ex-husband, always teased her about her extra breasts, which was the bra fat area. He'd always tease her about that. And so she actually called them her hate handles. They weren't the love handles, they were the hate handles because she hated her husband teasing her about it. So she came in and we told her we can do that.
So her motivation was she's going to the wedding is going to have to face the ex-husband.
Not knowing what kind of dress she was going to wear. Okay. She wanted to look slim and trim in her dress, to have that size go down. And she didn't want to have lipo in case she wore a lower cut. She didn't want any openings done where you have a little tiny scar. Granted, lipo scars are small, but you do have a little scar where you're going in with a little cannula. So you want to avoid that. So this does not have any scars or anything. So she had it done. The wedding took place. She was thrilled. The husband probably had his mouth open the whole time, and she just felt good about it. So self-esteem is such a big thing, and we try to help patients feel better about themselves.
Is bra fat an area that women are? There's a lot of women that don't like that area.
Definitely, I think they.
It's not something I personally notice. But what
you're going to start noticing now. When you go to the supermarket, you're going to see a lot of bra fat.
So there's a population of women that just drives them crazy.
It's an area you can't really, you can't exercise off. It just kind of pops out. Maybe menopause. Maybe after it's a fatty area that women develop.
So this machine, and I know these machines are like $100,000 machines, right?
They're
these are expensive machines.
Yeah.
You put these handles on that pinchable area, freeze the fat,
freezes the fat,
kills the fat.
And then it slowly dissolves and goes out of your system.
And then now they can wear a shirt and it's smooth.
And it's smooth, exactly, yeah.
Why are you so excited about it? Because you are...
Because I think we see happy patients. I can sleep at night knowing these patients are going to be happy. They come in and they're isolated areas. And I think because I've had it done, my husband's had it done, the whole office staff just about has had it done. Even some of my skinny, some of my medical assistants are very thin, and they've had it done. And you can have it done if you can pinch the inch. So if you can pinch the inch, we can treat you. And
but you were a lipo person at one time, right? Like 10 years you did liposuction.
Yes, I did tumescent liposuction, which is a very safe procedure that a lot of dermatologists do.
So how did you get involved, by the way? With this technology, with the fat freezing?
My husband actually had it done. He tried it out and it worked. He had tried several other machines before he tried the CoolSculpting. Nothing seemed to have worked. And that's where I think I was a little suspicious at first, or I was skeptical about it, because you hear about these other machines that don't work. And at a meeting that I was at with this one plastic surgeon who has 6 machines now, Grant Stevens, he says his other machines, and one in particular, he mostly hangs his dry cleaning on. So he doesn't use them. He mostly uses this CoolSculpting. Now that's not to say he doesn't do lipo every now and then, which I think there still probably is a place for lipo for some patients if they're going under and having some, a breast redo, or go ahead and do the lipo while she's under, or something like that. But I think for some people, they don't want that downtime. They don't want to have drainage. They don't want to have to be wearing their garments for another month or two. They want to be able to, we're very fit and time-conscious society right now. We're so busy all the time. And this, you actually could be working in the office while you're being hooked up.
So could somebody take a couple of hours off of work, do this, and go back to work?
Exactly. Go back to work, go back to work out, go back to being mom, pick up your kids after from school. It's that simple.
What do they want to know? Okay, so a patient calls or they show up. What do they ask you as a doctor as far as this procedure?
Well, they ask, am I a candidate? One, if you have like a beer belly, you're not a candidate. You have to pinch the inch, right? So it has to be fat that we can pinch. Certain areas we may not do. We're not really doing a lot of butts or outer thighs, but that may come one day that we will be doing that. So there's certain areas we have to say no to. But for most patients, they want to know how many applicators, how's my fat. We can look at their fat and we can actually determine and make a educated guess as to how much they need. We call it treatment to transformation. It's not just putting one applicator on and forgetting about that patient. We want to look at them and really analyze them and say, okay, she's here for her flanks, but we like to point out hey, by the way, you also have this upper abdomen that we could do as well, or we have this lower abdomen. You could do a flank and an abdomen at the same time. So we like to make them realize that this may be your problem that you're worried about now, but maybe down the line you might want to do some more, because you're going to eventually get to that problem is going to be the new problem eventually. So we point it out to them, and we're very good about that. We like to look, you know, there's a analogy that I make to fillers, for example. We used to, in the old days, just do a line. We would fill the line. Now we know, for some people, yes, the line is all they need to be filled. But for a lot of people, it may be the line is caused because their fat from their cheeks has fallen down, or they've gotten sunken in. So we have to look at the whole picture. The fat is here, but you also have fat here. Let's make sure you know that fat's there, because eventually you may want to have that treated.
Okay.
The line is here. We need the filler here to help this line here. So we really are an office that really looks at the whole picture. We like to look to the future.
So there is some artistic eye that goes into doing this.
Exactly.
Okay. And are couples coming in to do this?
That's right. We have boyfriends that come in and perhaps buy a gift certificate for their girlfriend. Then they want to know, can I get it done too? I've had a husband come in and he had his flanks done, and then he's sending his wife in after. I don't think I've had any couples come in together for it, but we could certainly do that if that were the case.
You should put together some sort of an incentive.
Yes, right.
Package.
Get everybody looking good.
You work on that.
Yes, that's right. Thank you for the idea.
Couples come in.
Couples CoolSculpting.
Couples CoolSculpting.
Yeah.
So the result, and by the way, that you said, and I like what you said on the phone. You said this is not for everyone, but if there's a part of your body, like a fatty area that drives you crazy, this is good for them. Do something about it.
Yes, do something. Here's something we can do about it, because before we really didn't have a lot to do. This is areas that are hard to work off. You'd have to starve and get gaunt in your face before you could lose the fat in that area. So this is something that still can look good in the face, have the fat gone with the CoolSculpting. It's a very easy procedure.
Didn't you tell me the patients sometimes apologize to you? Like as if they're too vain to get something done or something like that? I think you told me something about that.
Patients sometimes come in and think that what they're coming in for is trivial to them. Like it's, I had this little area, they're kind of embarrassed to talk about something. It may be a spot, it may be their fat, it may be a pimple or a line that they're worried about, but we're very understanding of that. So, and I'm in particular very understanding that, so I think I have a sympathetic way about me that I'm like, no, we're here for you. And I'd much rather tell someone if they come in for a spot that's benign, say, you know what, it's not melanoma. It's good you came in today. I'm glad I could help you and say it's benign. You know, but if it is something, that's good that you came in because we can take care of it while you're here. But I think for the fat too, they may say, oh, I've had this one area that I've never thought, they see our advertisement for the CoolSculpting and they go, I didn't know I could have that done. Is it that easy? You know, they're very surprised that it's available now.
What about the heavy patient? The person 50, 60, 80 pounds overweight?
So the 50, 60, 80, we can still treat those patients. If they have an isolated area of fat that really bothers them, we can really bring them down in size. We're not going to make them a skinny person, but we can take them down a couple of dress sizes, probably a couple of shirt sizes or pant sizes by taking, again, if it's fat, we can pinch. Sure. But again, not for a beer belly or a hard fat that you can't pinch. It has to be something we can really pinch.
Men, you're doing men, like male breasts?
Yes,
the man boobs.
As long as they're fatty breasts and not fibrous breasts. They have to be a special type.
How is it treating? Is it working? Have you done
it does work. Yes, it does work. It definitely works. The area, and that's a very sensitive subject for a lot of men that have man boobs, right? It's like, it's kind of hard for them to come in and talk about it, but we're there for them if they want to do it. We can help them with it if it's the right type of tissue.
So what about the saddlebag areas just on the side? So if it's loose enough to pinch, will it work there?
We don't do saddlebags at this point.
But thighs, you do thighs?
We do inner thighs. So the inner thighs.
Inner thighs, a big.
Yeah, inner thighs. Thighs rubbed, chafed, you know, or just that inner thigh is a very hard area to treat for a lot of women and some men actually.
Is that popular? So what are the most popular areas that you're doing?
I would say the most popular areas are the flanks, the abdomen, upper and lower abdomen, and the back fat.
Okay. How come it seems like the inner thighs would be very popular?
I think it is. I think those can be covered maybe a lot, and that's why people don't always come in for them, whereas it's more the areas that hang over areas that really bother people, like the jeans and the muffin tops, as you know, we described earlier. But thighs are, I think, as people know that we can treat them, they're getting it done.
Okay. Now,
it's a newer area. It's not FDA approved yet.
Now, the manufacturer has supplied some photos because you said you don't have signed releases from your patients.
Yes.
And so these are not your patients, but samples of what's possible.
Exactly.
Let's take a look.
This is a lady who actually is already fit. You'll say, what does she need? But she's one of these people that wants to look better in her workout clothes, better in her bathing suit. So if you look upper abdomen, better before.
So when you look at the after, yeah, that's
so it's definitely flatter, more
flat.
smoother. She's happy. This is someone who would be very happy with the results. For someone like this, if she had to lose weight, or she tried to lose any more weight, she would be so thin and so gaunt looking probably if she tried to do that. So this is a procedure for her that she can get down in size and look better without having to lose the...
So genetically, a little bit of fat cells right below,
right,
like her abdomen on the before.
Yes.
So those are dead.
And those cells are
right?
gone. They're
so
gone. So they won't come back. If someone were to gain...
Are you shrinking the fat cells or killing the fat cells?
We are.
I've asked this earlier, but I want to make sure. I mean,
they're gone. They're dead. Yeah, they are gone.
Interesting.
So
okay.
if she were to gain weight, she would probably gain it somewhere else, not in those areas. So that's what would happen. She'd gain weight somewhere else. But this is a fit person who's going to stay fit, I think, and not gain the weight.
So their
back.
goal is to just look great in a bathing suit.
Just look good. Yeah, that's right.
Okay, good.
Here's another series of pictures. You can see the before and after. Again, this isn't someone who's big. She just had an isolated area below and above her abdomen where she wanted a little bit of fat gone. Another thing in clothing, we're now seeing all these very tight dresses, the bandage dresses that are very tight that almost everyone has to wear a Spanx with. This really is ideal for those patients that are trying to look better in those clothes. It's nothing worse than to see some bulges in those tight dresses. So this is a great, a great treatment for those outfits, right?
All right, all right. Do you see people dressing differently, by the way?
I think they do. They start wearing clothes that are more fitted because they feel better about themselves, self-esteem. And we also have patients that actually have, not from the procedure, but because they are so enthused about the way they look, they actually do end up losing weight. If they're a little bit overweight,
start eating better.
They eat better. They say, I want to keep this up, and they're happy about how they're looking.
Okay.
So it's a good motivation. Here's another abdomen before and after. You can see whether she's a little bit fuller, upper and lower. And
on that before, you can see a little bit of bumps and kind of, and now it's just.
And this is one too that you really have to look at, but it's the hips. It's over the bulge over the jeans, and that's where. And this is someone who wanted to probably keep her shape, and so we have to be in tune to that. Some people don't want to be a boy up and down. They want to kind of keep a little volume there. So you can do one applicator. If she wanted to do more, though, she could come back and take more down if she wanted to. So I think that's something we can fine-tune it to the person to see what they want. So, Randy, look at the top of the jean, at the very edge there, right where the belt buckle.
On the before picture.
Before picture. You can see where that hump of fat is before. And you can definitely
kind of hanging over just slightly.
Just hanging, it was a little pinch, a little inch to pinch, right? A couple inches to pinch. And you can see on the second after picture that she definitely is more shapely there. There's not as much of a fat to grab there, just a nicer shape to her whole body there.
Okay.
Here's another one that shows the back fat. This is great. It shows the back fat before and after. And you can really see how her whole back is flat in there. She probably had a couple of applicators put on there where it's upper back fat, lower back fat, and the flanks as well. And the skin tight, even though it's not made for tightening, it actually, you can see some tightening in that picture.
Because that back fat is tough to get rid of.
It's hard to get rid of. So just look at the crease in the before picture. You can really see that crease there where her fat bulges out underneath it. And then you can see in the after picture where there's really hardly a crease there at all, if any, and the fat is down in that area below the crease where the crease was.
Okay, now your husband.
Now here's my husband. So here he is beforehand, where he had.
He's looking pretty good.
He looks pretty good. He's very fit. Works out all the time, aerobics and cardio and the weightlifting. And there you can see the inch to pinch above his waistline or above his belt buckle there, or pants. And then after, you can see he's much more shaped in tune there, where the fat is down. I can't pinch him in that area any longer.
Now he told me. He said, you know, he was in the studio earlier, and he said that. Unless he was sick, he could never get rid of those level
right.
heels.
Unfortunately, he's not sick, knock on wood. So it's like, yes, it's just a hard area to get rid of. And he tried everything, and exercise really does not get rid of that. So this really, because of my husband getting it done, that's why we had the machines in the office.
You say the softer, the more jiggly the fat, the better they treat. Is that correct?
Well, I think that fat does respond quicker to the treatment. So yes, actually having that jiggly fat, that kind of doughy fat, may have a better result initially. Okay. We can get a harder, firmer fat to that point, but it may take more than the treatments for a soft fat.
At what age should somebody get this done? Is there an age?
Well, you know, I think we would start at 18, nothing younger than 18. And then I've actually had a gentleman in my office just recently who was like 82, and he wanted to come in to see if he was a candidate. And we said, we think we can get you better. So if someone really, there's not a cutoff, you know, if they're worried about their fat, if it's bothering them, why not? People are living to 100, you know, we're a fit society. Something's bothering you. I don't think there's really an age limit other than we'd probably start at 18 and move on.
So how did they figure this out, by the way?
Well, it's pretty interesting. There's a famous dermatologist in Boston at Harvard, Rox Anderson. And we've known for years that there's a popsicle paniculitis, where people, kids actually, babies, were sucking on popsicles and they lost their fat. Their fat decreased. Now with babies it came back. The other was the women that rode horses in the cold, and their outer thighs lost fat. The inner thighs, because of the friction with the horse and the bridle and the saddle, that area did not thin out, but the outer thighs did. So they
because of the coldness of the saddle.
So that coldness on the outer thighs, the coldness on the outer, whereas the inner thighs did not work because the inner thighs were were next to the saddle on the horse, and there was heat there, whereas the outer thighs were getting the cold from the air. So what they thought of, if the cold can do this and not ruin the skin and the nerves and the arteries and everything else, how can we apply that into a machine? How can we get the fat gone where we want it to be gone with the machine? And that's how they started working on this, from the principles of the popsicle paniculitis and the horseback riding.
So there's a lot of people with unwanted fat, abdomen, bra strap area, that refuse to do surgery with liposuction, right? So is that who this is perfect for people that don't want surgery?
I think it's good for people that want to come in, have an easy procedure done. They don't want the downtime. We're a very fit society. We don't want to, we're always busy. We're going on our iPhones, we're running to work, we're doing this, we have the kids to pick up, we have to cook dinner or whatever. I have a husband that cooks dinner, though, by the way, so I'm very fortunate. Okay. But we're very busy, and so we don't want anything that's going to take us out of commission, right? We don't want to have 10 days of downtime. We don't want to be draining and dripping blood and water and whatever. So this is an easy procedure that's safe. It's safe to do. It's easy. You walk out. You're able to go work out after. You're able to go back to work if you want. It's just a nice procedure. So there's tens of
thousands of people in Colorado that could be candidates. You say that it's a fit area. There's a lot of people, though, with little areas.
One of the most fit.
But still, little areas. A lot of people could benefit.
Isolated areas that are hard to fit. But we could also treat a more global treatment with patients that are a little bit bigger, that want more of they want to go from a size 10 to a 8 maybe, or something like that, where we could take them down, right? So I think that we could also treat it. I don't want to leave those people out that.
Because you'd like to see both type of patients.
We see both.
The bigger patients, the fit patients.
Exactly, yeah. The bigger
do you think if they all knew about this, that they would be lined up to do it?
I think
a lot of feeling like that?
I mean, definitely, yes. I think because it's a very easy treatment.
So we are completely out of time, but I want to thank you for coming to the show. Great
thank
information.
you for having me, Randy. I enjoyed it. It's very nice talking to you.
And these photos, you can take a look at them on your website.
The website, definitely.
And a consultation is free?
Free consultation. Come in. We
Do
look
they get
at
to meet with you?
They get to meet with me. I walk in on every consultation. Yes, they get to see me, and we get to pinch your fat.
Okay, good.
So we are hands-on a little bit.
All right. Well, thanks for coming.
Thanks for having me.
You'll watch The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, just go to our website at wellnesshour.com and put in Dr. Stewart. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.